Welcome to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. Today we're talking about eye health and what you should be looking for to maintain good vision. But before we get started, let's take a look at what's coming up on the show. Education for parents on how kids are getting drugs via social media. A group trying to stop Medicare fraud, plus treatments for neuropathy. All that and more on this episode of Your Health. Increased screen time has taken a toll on our eyes this past year, and here to talk about eye health is Dr. Michael Kozlowski from Midwestern University. Welcome. Thank you so much for being here with us, Doctor.
Thank you. It's a pleasure to be on with you.
First off, what has all this screen time done to our eyes this past year?
Well, I think it's done a couple of main things. One is that it's made our eyes drier. When you concentrate on a screen, several studies have shown that it reduces the blink rate, so you don't refresh your tears as often, so they dry out and your eyes get dry. Another thing is it's made our eyes feel more strained, sometimes causing headaches. And many times this is because of improper visual corrections. That is, our glasses or our contacts aren't the correct prescription, or maybe we don't wear any glasses or contacts and we really need to. I should just say that the increased screen time has also created non-vision problems. If you are using your device late at night when it should be dark and exposing your eyes to blue light, then your circadian rhythms can become confused and that can interrupt your sleep.
Now, Doctor, what are the signs that we should be looking out for that might suggest or indicate that there is a problem with our vision?
Right. So one of them that might be a sign that you need a new vision correction is that eye strain and headache we were talking about. But another aspect of that some people notice is that their computer appears clearer while they're reading, but then when they look up, things in the distance look blurry for a while. And that's another sign that your visual correction is not proper, that you may need to upgrade that a little bit. In terms of dry eye, the problems to look for are burning, scratchiness, blurry vision that clears up if you blink a few times like this. And of course, any change in vision, things like flashes of light that shouldn't be there, new floaters, the feeling that someone's drawn a curtain maybe over part of your vision, halos around lights, any vision change that you notice, you should always have evaluated by your eye care provider.
Now, our kids have definitely had, more screen time during the past year. So talk to us about how important it is to get their eyes checked as well.
That's a very good question. Well, all children should have annual eye examinations, beginning at least at the time that they enter school, because clear vision is so important to success in school or sports, whatever you want, and children's eyesight changes as they grow and develop. But particularly in this time with more screen time, that generally translates to less time outdoors. And several studies have shown that spending less time outdoors increases the development of myopia or nearsightedness.
Now, you all have a full-service clinic there at the Midwestern University Eye Institute. Can you share more with us about that?
I would love to. We can provide full primary care, glasses, contact lenses, health examinations, pediatric eye care, vision therapy, specialty contact lenses, treatments for things like dry eye that we discussed or ocular diseases. We have a group that deals with sports vision, or on the other end of that, low vision and vision rehabilitation, acquired brain injury. We have electrodiagnostic services, and then complete ophthalmology services for things like cataracts and vision correction surgeries.
Doctor, thank you so much for your time. Such great tips, such great advice. If you'd like more information about Midwestern's Eye Clinic, just head over to their website. Today, kids can easily get their hands on drugs thanks to social media. One group is making it their mission to educate parents on these trends and why it's so important to talk to your kids.
Ethan is this young man who would light up a room. He is kind, loving, funny, strong, compassionate, and had a heart for service. He was a pure joy to be around. when things got challenging, he was always said, Mom, there's a purpose to this. There's always an opportunity, Mom. And we've got to speak about that. That was Ethan's heart. Ethan died February 16th, 2019. He was at home, and I found him in his bedroom looking like he was still sleeping.
What we're seeing right now in Arizona is an alarming number of teenagers overdosing and dying from these counterfeit pills laced with fentanyl. In fact, in 2020, 14 children died from opioid overdoses and like these counterfeit pills laced with fentanyl. So right now it's critically urgent and important for us to be talking about this issue. Most of our teens are getting access to these pills in a couple of different ways. We do know that they're using in groups and social settings with other friends. So that's one of the ways that they're getting them. The other two key areas are through text messaging and through social media apps. Offers come to them on their phone and they'll see ads for those selling pills or selling marijuana. And we've seen a number of cases where that's where our kids are getting access to these pills that have killed them is via social media apps or text messaging. It's really difficult to stay on top of technology all the time. And that's one I always say, talk early, talk often, and be there at the crossroads for kids if and when you can. And being at the crossroads means after school, it means at dinner time, it means when they come home from a date or come home from a party. There has to be a conversation, yes, about the substance and the technology, and I think that's really hard for parents because if a child is using, the earlier the intervention, the better the outcome for that child. One of the most important things that parents can have in their home is a medication called naloxone. What naloxone is, it's an opioid reversal drug. What happens with naloxone is it can be just a simple nasal spray. Once you put the nasal spray into the nose, it immediately brings that person back to breathing, their heart starts pumping, and they get a second chance of life. Naloxone should be in everybody's medicine cabinet because a lot of times we think as parents, not my kid, not my neighbor's kid, not my friend's kid. So just take that prevention step and have naloxone in your home, especially if you have young ones or young adults. Everyone's invited to go to talknowaz.com. There's all sorts of great resources on there about fentanyl and naloxone. And also just remember that there is hope and help with healing. If you suspect a loved one has a substance use disorder or is using these fentanyl pills, there's a line that you can call 24/7 and get them into treatment right away.
A friend of mine said, when I started this media campaign, she goes, your strongest advocate will be right to your side. And that is so true. That is my son, Ethan.
As part of your annual eye checkup, you should also be getting a dilated eye exam. This simple test allows the doctor to check for multiple eye diseases early on. Here's what's coming up on the show. We meet a group of incredible nurses paving the way for others in the healthcare community, and a group trying to combat fraud and scams associated with Medicare. The San Diego Black Nurses Association is at the forefront of helping their community during this crucial time of staying healthy.
The association was founded to ensure humane treatment for all and to improve the health of all African Americans through culturally competent healthcare services and community-based programs. And that's basically what we're about. Some of the health risks out there are rampant within our community. And as you know, especially with COVID presently, those health risks are just driving through the African American community. Diabetes, heart disease, high blood pressure, those are the individual of high risk that are ending up in our ICUs. So it was important, and it still is important, for individuals to know what their health risks are, and for us to be out there and be proactive in teaching them how to avoid those health risks. For these individuals need to know, first of all, you're at risk. Second of all, you need to take your medication. Do you have the funds or do you need assistance in obtaining that medication? What have you been communicating to your doctor? Have you seen your doctor? So it's important for us to be able to communicate with them and for them to know that there's someone sitting across for them that can actually help them understand what they need to know. We have also been instructing and teaching individuals on how to wear a mask, how important it is to wash your hands, how to put the mask on, how to take it off, how if a mask gets wet, it's no longer any good, and teaching individuals why they need the vaccination, what it is, and what it's going to do for them, and what the percentage is of both vaccinations. In fact, one of our nurses was one of the first to be vaccinated here in San Diego, Brittany Randall. Challenges during the pandemic, the regular day-to-day procedures of healthcare systems, everything's been altered abruptly. As nurses, healing a patient gives us that sense of accomplishment. We are nurses, that's a service profession. Currently, with the pandemic, our service and accomplishments are very, very limited. Let's remember, everyone, to maintain immunity in our community by masking up and washing our hands.
Medicare fraud is rampant in the U.S., and the Senior Medicare Patrol is educating the community about how these scams can impact them.
Senior Medicare Patrol is a federally funded program of the Administration for Community Living. In Louisiana, Mississippi, and Georgia, Senior Medicare Patrol is sponsored by EQ Health AdviseWell. Our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare errors, fraud, and abuse through outreach, counseling, and education. The mission of SMP is important, but we are a program with a small budget. We have no more than 4 paid staff in the states we service, so our program relies very heavily on volunteers to help us educate seniors statewide. In the past few years, we've educated over 350,000 people through community outreach and educational events and spoken to over 3,500 people one-on-one, plus countless other beneficiaries were reached via media exposure virtually, and especially this past year in all 3 states. With the help of volunteers across Louisiana, Mississippi, and Georgia, SMP educates seniors and their caregivers by providing short 20-minute classes that teach them to protect themselves from Medicare fraud. We also attend health fairs and other community events where we distribute information about Medicare fraud and healthcare scams. Since June 2015, EQ Health AdviseWell's Senior Medicare Patrol has had an average of 250 volunteers working in the 3 states. These volunteers help by attending community outreach events and giving education sessions in their communities. There are over 800,000 beneficiaries in each state, so volunteers are critical to aid in our outreach efforts. These events are typically held at senior centers, churches, independent living facilities, and senior housing. Many of our volunteers are retired nurses or former educators, people who are familiar with reading their Medicare summary notices and the basics of Medicare. If someone is interested in volunteering for our program, they should contact SMP at 877-272-8720 to receive information about our volunteering. For our program, all volunteers go through a thorough screening process and receive training. The federal government estimates it is losing anywhere from $60 to $100 billion every year to fraud, waste, and abuse. Protect your Medicare card, the red, white, and blue card. Never give the Medicare number to a stranger, especially someone who calls on the phone. Review the Medicare summary notice and look for anything odd: dates, doctors' names, locations, services provided. If you find something odd, call Senior Medicare Patrol. Report it. We can help determine if there is a problem, help resolve it, and if you think there is fraud involved, we can report it to the appropriate authorities. Also, be careful with scam calls or people going door to door asking for your personal information. Never give it out, and if you do, call SMP and let us know what is going on. If you are available to attend one of our educational sessions, please do so. Or if you see us at a health fair or community event, visit our booth and ask us your questions. We will be happy to help you. You are also welcome to attend any of our virtual events from your laptop or smartphone to learn more about SMP. And finally, you can always call us at 877-272-8720 or visit stopmedicarefraud.org for more information. You'll always get a live person on the phone if you call during business hours.
Stick around, here's what's coming up on Your Health. We get answers about the COVID-19 vaccine and dispel some myths, and how you can ease the pain of neuropathy. There's a lot of misinformation about the COVID-19 vaccine, and the California Department of Health wants to educate the community about why we should take our shot.
So COVID-19 vaccines teach our immune system how to recognize and fight the virus that causes COVID-19. It stimulates your immune system to produce antibodies that can fight off the real disease. It typically takes about a few weeks after the vaccination for the body to build protection or immunity against the virus. And after you get vaccinated, the developed immunity allows your body to fight it off naturally. So the vaccines do not contain coronavirus and cannot give you COVID-19. Clinical trials have proved that COVID-19 vaccine is safe and 100% effective in protecting against severe illness, hospitalization, and death for youth in those aged 12 to 15. All Californians aged 18 and over are able to receive the Pfizer, Moderna, or J&J vaccine, and young Californians aged 12 and older are able to receive the Pfizer COVID-19 vaccine. No fertility loss was reported in the clinical trials or in the millions of women who have since received the vaccines. Getting vaccinated is the best way to protect you and your unborn child. If you're trying to become pregnant now or want to get pregnant in the future, the COVID-19 vaccine has been proven safe and effective. If you want to get pregnant in the future, there is currently no evidence that any vaccines, including the COVID-19 vaccines, cause fertility problems or problems with those trying to conceive. The unfounded claims linking COVID-19 vaccines to infertility have been scientifically disproven. And the American College of Obstetrics and Gynecology, ACOG, recommends vaccination for all eligible people who may consider future pregnancy. So as of May 27th, 2021, the first 2 million Californians who start and complete their COVID-19 vaccination process will be eligible for an incentive, which are a $50 virtual prepaid card to be used at any business where MasterCard is accepted, or a $50 grocery card. And you can choose between Kroger grocery stores, which includes Ralph's, Food for Less, and Foods Co., or Albertsons, which includes Safeway, Albertsons, Bonds, Pavilions, and Andronico's community markets while supplies last. So once the state confirms that you're fully vaccinated, you will get a text message from the California Department of Public Health and My Turn it'll come from the number 23393 with a link and a single-use code to redeem your incentive card. If you don't have a cell phone, but you do have an email account, you'll get an email with that link. And if you don't have a phone or email address, you can also call 1-833-993-3873 about 7 to 10 days after your vaccination, and you'll be able to receive your card that way.
Don't go away, we have more coming up on Your Health. Treatments to help with the symptoms of neuropathy. It's estimated that about 30% of Americans will be affected by neuropathy, and the doctors at True Health can help your symptoms with their innovative treatments.
So neuropathy is actually more common than we think, and it is nerve damage. So there is over 100 reasons to why neuropathy happens. There is diabetic neuropathy, there is chemical and medication-induced neuropathy. There is also idiopathic, which means we don't know why it happens. But regardless of the reason, we need to know why it's happening and how to treat it. Over time, as these nerves are damaged, they cause patients symptoms like tingling, burning, cramping, Patients are not able to sleep. So with time, this can take a big toll on patients' quality of life. It's very important to treat neuropathy without medication because the medications are simply designed to mask the problems. So as we continue to mask these symptoms, they're just going to get worse. And a lot of these medications, they actually numb your brain, which means they numb the pain. They don't do anything about the root cause of the problem. Our most successful patients are ones that are highly motivated. They don't want the pill for an ill formula. We are the type of clinic that will work with people who are highly motivated to get better. In doing so, using these FDA-approved, groundbreaking treatment modalities, we're able to remarkably see patients do better. Our patients actually do really, really well, where we're able to see these symptoms go away because your body can heal. Your body can heal and wants to heal without medication.
Once the regimen was established, I felt comfortable with it, and I have shown nothing but marked improvement. When I first came in, it looked like this. Now that I'm completing my treatment, this is what I look like. Prior, I was experiencing neuropathy and cramps during the night. I couldn't sleep all night. Presently, I can sleep the whole night. I'm walking without a cane, and my quality of life has vastly improved.
So when our patients come in for nerve damage screening, we do a touch-based exam because these patients have been poked and pried so many times, so this is completely pain-free. This is one of our very severe cases, and you can see that because of the many areas that they have complete black. Black is total loss of function. You can see that just few short treatments later, they went from this to this, and this is how we know that they are actually progressing and then they're improving and their symptoms are going away. At True Health, we pride ourselves in treating all patients like family. So we bend over backwards for our patients when they come in here for treatments. They want to be here. They love coming here. We have a location here in Chandler, Arizona. We're also located in Scottsdale. And we are ready for you to come in, again, for that free exam and consultations where we can go over your symptoms, see if you make a good candidate for the treatments that we have. We are ready for you. Let's get your quality of life back. You have nothing to lose but your neuropathy.
Thank you for joining us on Your Health. I'm Erica Cardenas. See you next time.